now we're kind of in phase 2 of the procedure. This is the planning to the site making. The first part of the procedure is actually obtaining the grafts. So we've punched out the grafts, and we've done it in a way where we didn't shave his entire head. We did it with the ARTIST robotic system. We do what's called a lift and shave with people with longer hair, that we lift up the hair, shave a segment, and we're able to, usually we can get 15, 16, 1700 grafts just with lift and shave, and you don't have to shave your whole head. So a lot of people think, oh, I got to shave with the ARTIST. No, you don't. You know, sometimes you do, sometimes you don't. So now we've decided we're going to work in this Vertex area, so we're doing site making. What we always do, we kind of mark the epicenter of the whorl in the back. You know, that's where the hair kind of generates that swirl pattern from. And we usually put singles in the middle because you don't want big chunky grafts coming out of your whorl pattern, because that's not nature. What we do, all we do is imitate nature. So we're going to start making sites. We're doing this with a 21 gauge needle, and these are ones. So we'll count these. So a lot of people always ask me, you're not going to injure my hair while you put the other ones in. And I always look at them like, wow, of course not. Why would I do that? Because that would be defeating the purpose of the hair transplant. So the answer to that is no. I'm not going to injure your hair at all. And to make sure, we wear magnification. So this process is very tedious. All we're doing is imitating nature. Yes, you're an artist, but nature is the ultimate artist. So you want to just look down, see the pattern of the hair, and give him back what he had. You don't want to use your interpretation or give somebody what you want them to have. You give them what they had before, the exact pattern they had before. And then that makes it, you know, a lot simpler, so you're not trying to have to think, oh, what am I going to do here, what am I going to do there. You kind of just do what they had before. So we're still working on the back in the Vertex. We've kind of done this, what I call the epicenter of the whorl, and we do that with ones, very skinny grafts, because that's the center of the whorl pattern. You don't want thick grafts coming out of there because that doesn't look natural. You want that to be nice and soft and refined. So around that we'll put bigger follicular units, so I'm doing that now with a 1.3 Mindy blade. And again, I'm wearing 6 magnification so I do not injure the existing hair, because that would defeat the purpose. Plant new hair, kill old hair. That's not what we want to do. And all I do is follow the direction, the angle of the pre-existing hair. Okay, so we continue to make sites in the back, in the Vertex. Now, Patrick's already had transplantation done in the front to kind of get the frame of his face. We always tell patients that it's always better, if you had a choice in a first transplant, to put the hair in the front because it frames your face. And then come back later, if ever, and do the back. The back, the hair doesn't shingle as well as the front, so graft for graft, it never looks as thick when we plant hair in the back compared to the front. That's just the architecture of how the hair falls. And medicines like Propecia and Rogaine seem to be more effective in this Vertex area at reversing the miniaturization process than in the front. So a lot of times we'll transplant the front because you can't really do anything to increase, you know, or reverse miniaturization, but in the back you can, and we'll treat them medically back here and see what happens. If it doesn't improve, then we come back and transplant the back. And that's what we're doing today. And the back always will take more grafts than you think because it's bigger than you think, basically.